Okay, welcome to our interview today, presented to you by EritreaHealth. My name is Dr. Ibrahim, Dr. Kemal Ibrahim, and I want to present to you an interview that I'll be doing with a very sort of esteemed guest and a peer of ours, Doctora Eman Yassin. We'd like to welcome her and talk to her today about COVID-19 and common questions that are on people's mind. So Doctora Eman Yassin, I'll just give you a little background to her, and I'll then hand over the mic to her to be able to introduce herself. So just a little bit about Doctora Eman Yassin. We went to university together, which is where we know each other from, which is King's College London, where we both study medicine. And she is a general practitioner in the UK, so that in other countries is known as sort of a family physician. She's currently working in the frontline community services to help with the battle against COVID-19. And like I said, she studied medicine at King's College London, and she also attained merits for her studies and first-class honours in translation medicine, which is really amazing. She's been doing so much teaching in her time as a medical student and as a doctor, and currently she teaches at Queen Mary's University in London, UK, and she trains and teaches medical students and trainee GPs in London, which is amazing. So we're really lucky to have her. In addition to that, she helps students with their personal statements, with their resumes, CV, and she really loves education and mentoring, and this started from a young age. So we're really glad to get some of that experience today. So in terms of her work experience, she's worked with many public bodies, which has really built up a wealth of experience. One of those being NHS England, Public Health, the British Medical Journal, and the Royal College of General Practitioners. And not only that, her current research has also won a peer prize and is to be rolled out across the UK. So maybe she can tell us a bit more about that today or in a future interview. So without further ado, I would like to say salam to Dr. Eman Yassin. Assalamu alaikum. Thank you for coming on and entertaining our questions.
All right. Wa alaikum salam. Thank you for having me.
That
was quite
and so can you, we're really proud to have Eritrean doctors like yourself who have worked really hard and, studied at a top level, talking to us. Can you tell us a bit more about your personal background, your Eritrean background, and a bit about yourself in the medical world?
I came to the UK when I was about 3/4. So I did all of my studies here. Okay. I live with my family, have a great family support.
And your family's from Eritrea?
Yeah, mum and dad.
Fantastic.
Are Eritreans, yeah.
Yes, fantastic. And in terms of your medical background, I've mentioned that you're a general practitioner. So where are you working at the moment as a GP?
Mainly East London at the moment, sometimes South East. I did work in Kent for a little while, but then I moved over to East London.
Right, so lots of different experience. And, with COVID-19 at the moment, things for doctors have really changed, and we've had to really adapt to changing circumstances. Mm-hmm. So I want to get right into this. As a GP, what is your experience of working with COVID-19 at the moment? How is your work at the moment?
Okay, my work is super different to the way it used to be before. It's literally done like I would say like a 180 over the last few weeks. Okay. Originally, we used to do face-to-face consultations all the time. People would come in all the time, and we don't do that as often, but we still do telephone. And thankfully, being here with the computer systems that we've got, we also do video consultations. And so that's really nice, yeah.
So that's really interesting. So is that a new way of working for you, using video? Is this the first time that as doctors, family doctors, that you have to use that? Or do you have experience before?
Yeah, we've got experience using telephones and emails and people sending in things. Sometimes we do use videos, but not that frequently. Now it's literally part of day-to-day life. So
okay, wow. And how are you adapting to that change? Is it more difficult seeing people, you know, taking history, trying to understand what their medical problems are?
It's interesting. I've had to teach quite a few elderly people how to use their smartphones and how to do the videos.
Fantastic.
That's been quite fun. It's been a bit funny at times, but mashallah, they've all gotten it really well. Well, it is a little bit difficult because you can't see the person right there with you.
Yes,
and you can't do a full examination like you would do if they were right there. So you can't really touch or listen very well, but you can do quite a lot that I'm learning every day. So that's quite nice.
And I was going to ask actually on that, you know, we a lot of people in our teaching, those who've taught us, have always said that the biggest part of understanding a diagnosis is the history, and the examination is more sort of 20-30% where you sort of confirm or deny to seeing a few signs. So I guess you're getting the majority of it over the phone or on video, but I guess that physical examination is still quite important. Do you see any quite sick patients physically who come into your GP practice that you sort of prioritize as really unwell, or do you not see anyone at all physically?
So I have been seeing patients. Sometimes I'd have to be, in the beginning I wasn't fully gowned up. I didn't have all the kit that we're meant to have. And then slowly we started to get more kit, and we basically have to be gowned up with full personal protection all the time now. You're right about the history being the most important part, and it is the most important part of a diagnosis. Also, when they give a history, you're learning a lot about their breathing as well. So that helps with the examination anyway. But the fact that we can use video consultations, some of our patients, we give them oxygen monitors so they can check their oxygen right there and then. They have machines at home, so we say to them, can you just check it right there while I'm on the phone and tell me what the numbers are?
So that would be, for example, your oxygen levels, and if they're quite low, that might be dangerous, and if they were normal, that would be more reassuring.
Absolutely. Use all those things.
So I've got some goggles here, which is part of the personal protective equipment. It's called PPE for our audience. And you were talking about gowning and the kit. So could you tell us a bit more about how you are protecting yourself as a frontline worker? And just as a background to this, we are seeing actually that in some countries like Italy, that about 10% of the people who are getting COVID-19, or maybe just a bit less than that, are healthcare workers. So there's a lot of danger. We know that in the National Health Service of the UK, because that's where we're working, that there have been, I think, up to maybe 12 doctors and many more healthcare staff. So there is definitely a risk that people like yourself on the front line are taking, and myself, when we're examining patients. So tell us a bit more about how you protect yourself in practice.
Okay, so there are a few different things that we do. The first thing is, if we can do a lot of the history taking over the phone, with the patient not being in the room, then we do that. And we only see them if we need to do an examination. If we need to see them, depending on what their symptoms are, you'd have different types of personal protection. So sometimes it can just be gloves and an apron. Sometimes there's always a mask, but sometimes the level of the mask, or how good it is, will be different. And sometimes I think once or twice, I had to wear the full like hazmat suit, you know, like.
So tell us a bit more about that. What does that do? Does that cover your eyes, your mouth, your whole face? Some people have a hood. So is that the suit that you're talking about?
So it literally looks like, I don't know if the viewers watch any crime scene investigation shows, it literally looks like one of those fully covered, literally it's just your face.
Forensic
officers with the goggles, absolutely. Cover your head to toe, and plus you've got the extra stuff, so It's a bit uncomfortable, but you got to do it.
Yeah, I can imagine. But I guess the main thing is the safety. There's quite a high risk.
Yeah.
And so I guess moving on to actually how serious COVID-19 is, could we sort of talk a little bit about that? Because, you know, our viewers have heard lots of different things. Some people think it's, you know, maybe just like the flu, and not as serious as everyone's making out to be. How serious is COVID-19, and what should we do about that?
Okay, so compared to the flu that we get every year, this is a lot more serious, a lot more dangerous. People react to it differently. I mean, we've just had one of our fellow Eritreans here who was diagnosed with it, and he's thankfully out of hospital and he's well in himself. So some people are very lucky in which they get no symptoms. Some people can get simple cold-like symptoms, but most people do get the really bad flu symptoms, or just way more exaggerated than normal. So really high fever, a really bad.
So what would that temperature be on if someone has a thermometer at home they want to check? What would they be worried about?
So NHS England say temperature above 37.8.
Okay, and that's Celsius, because some people in the US, for example, use Fahrenheit.
Oh yes, that's true. I don't know Fahrenheit.
Yeah. So 37.8, did you say?
Yeah.
Okay. Yep.
If they have a persistent cough, if they have lots of aches and pains in their body,
and just on the cough, is that a new cough? That because some people have old coughs and they say, well, I've always had a cough.
Yes, it's a new cough or a change in your cough for the worse.
Yes. Okay. Right. Yeah, and what were the other ones you're talking about?
So you have generalized aches and pains in your body. You can get loss of smell, loss of taste. You can get, some people even get diarrhea and vomiting.
Okay.
You can get a whole host of different types of symptoms, but the fever is the most common, and the cough.
Yeah, and why is it more serious than flu? Is it because more people are having to go to hospital, more people need support with their breathing than in the flu?
Well, it's just that we, as humans, have never encountered this type of virus before.
Okay.
So our body is reacting to it as it would do. And so it's also a lot more aggressive than the flu. So that's why a lot of people have ended up needing to go to hospital and needing to be put on ventilators and
it seems a lot younger. A lot of the patients are younger than usual, in terms of having to go to an intensive, really high level of support, intensive care. It does seem quite serious.
Yeah, it is quite serious, and that's, I think, the take-home message that I really want to give is it is serious. Don't take it so lightly, and really look after yourself. Yeah,
and I guess in the sense that who it affects, when we talk about young people, it means that it's affecting not just older people, not just people who have underlying health conditions, because everyone feels that, okay, it's just for old people, it's just for people who have, you know, underlying sickness. But actually we're seeing people who are quite well, who are quite young, so it's affecting quite a broad spectrum, it seems.
Yeah, that's very, very true. It is affecting, it literally doesn't matter who you are, where you're from, it can affect you.
Yeah. And so let's assume, so our viewers, maybe they've got the fever or cough. How would you suggest or recommend them to manage their symptoms?
Okay, so if you've got a fever, the advice is that you take some paracetamol to help control that fever. Okay. If your fever is quite persistent, so it's just constant, take regular paracetamol. So that will be usually 2 tablets, so 1 gram 4 times a day. Drink loads and loads and loads of water to keep yourself hydrated. Okay. Let your body help fight the infection by keeping yourself hydrated. Eat and drink well. Give yourself some rest. Some people say, well, I usually find that steam helps a lot with opening up your airways, helping with the congestion and the headache. Yeah.
Okay, because actually I was going to ask you about that for people who are having breathing problems. That's something that I've seen and heard about. Can you tell us a bit more about this, Steve, and what our viewers can do to try and help themselves?
So when you are sort of like everything's bunged up here and here,
Okay.
And you've got a sore throat. So everything's really closed and congested. So what you want to do is open all of that up. That's what steam can do. I would say regular steam inhalation.
So that would be put in terms of to keep themselves safe, having it in a bowl, hot water.
Yep.
And
you can do like a bowl of hot water. Make sure your face is not touching it. Just have a towel over your head and just lean over.
Yeah.
Make sure there's about 20 centimeters between you and the water.
Yeah.
The other more safer route, and I usually say this for especially kids, is have the shower on really hot. Make sure the kid's not in the bathroom.
Okay, so this is for children.
Yeah, and then let the room really steam up in the bathroom. Turn off the hot water so the room is still quite steamy and hot. And your kid and you can just sit in there. You can
and just maybe do deep breathing and sort of take it all in.
Absolutely.
Yeah. Because I guess if it's an adult who has this hot steam in front of them, they have to be careful that there are no children running around. And no accidents or burns from hot water.
So I usually prefer the bathroom shower technique, where there's no chance of you burning yourself. There's no chance of any injuries.
So even for adults, that's also a good technique.
Yeah.
Okay, fantastic. That's really helpful. And some people talk about oil diffusers. Is that something you've heard about in your practice? Do people ask you about things like that?
Yeah,
that helps with breathing.
People have been doing that for many years for colds, flus, any type of congestion in your airways. People use eucalyptus, people use Vicks, people use Olbas, people use citrus sort of smells, and they find that it helps with the steam. Not usually on its own, usually with the steam, and it really helps out with their breathing.
Okay, so I guess like there's levels of symptoms. So fever, cough, the symptoms that you've talked about, and then the more severe it's becoming, the more I think from what I understand is that breathing becomes very difficult. And so the steam, I think what you're saying is helping with congestion, but also with breathing. Am I right?
Yes, that's correct.
And is there anything, I guess, if a person is at home and they're having difficulty with their breathing, that they can do in terms of physical techniques of how they breathe? I've heard that being on your front takes some pressure off your lungs, and deep breathing exercise like that help. Is that?
Yep. There are some deep breathing exercises. I've sent you a link for one of them, so you can attach it.
So we can put that in our description under the video. Absolutely. Thank you so much.
So it's about taking nice big deep breaths and holding it for a few seconds, then breathing out. This is just a rough, quick guide of the video. You do that about 7 times, and then you just take really big deep breaths naturally. And then you also, what you said, you lay on your front and you do those breathing exercises again. They're very, very similar to chest physio. So chest physio is exercises that helps people with lung issues anyway. One of my friends has cystic fibrosis, and this is something that she does literally every day, twice a day.
So cystic fibrosis is a lung problem, isn't it? Where they have a sticky lung, difficulty breathing. So you're saying that the physical methods of sort of moving the lungs around and doing the breathing helps in that condition, and for example, people who have COVID-19. Absolutely,
because it helps open up the airways, it helps you get more oxygen in, it helps clear out all the gunk that you might have at the bottom or on the sides. It's really, really helpful.
Fantastic. So I guess when we talk about levels of severity, we from what I know, around about 80% or just over that have mild symptoms that can be managed at home. When does it get to a point where somebody, maybe our viewers at home or somebody they know, feels, okay, actually this isn't getting better, I'm in quite a lot of distress with my breathing? What are the options in terms of how they should get help and manage the severity of what's going on?
Okay, so most people who are otherwise quite healthy, their symptoms get a lot worse by day 6, day 7, day 8, day 10.
So it's not straight away. It's not straight away. It almost gradually builds up. Okay.
So most people fall into that category. However, there are a certain group, so that could be people with health conditions or not, that just react very differently, and they can become a lot more worse a lot quicker.
Okay.
So in those situations, if you are a lot worse, if you feel that you can't control your temperature, if the pain is really bad or the breathing gets a lot worse, that's a situation where you need a healthcare professional. You need someone to help you. That's where the 111 service comes in place.
So in the UK, we have a service on the phone, an emergency service where you can get advice. So that's the 111 that you're talking about. I think it's important for anyone watching this outside the United Kingdom to find out what your services are in your country, whether that's in Europe, US, Africa, Middle East, what is available to you. So here we have an advice line called 111. So someone can call them up, and what would happen when they call?
So when you call 111 up, sometimes it's a doctor, sometimes it's not, and they go through a list of questions, asking you how you're feeling, what sort of symptoms you've got. So whether you've got a cough, difficulty breathing, fever, if you've got aches and pains, if you've got a headache, if you've got any vomiting or diarrhea or anything. They go through a list of questions and they work out how serious your condition is at that moment in time. They then transfer you to a doctor, and then the doctor can do another full assessment. That can be on the phone or via video, or that can even be face-to-face.
Right.
If they feel that no, your symptoms are not too bad and you can manage at home, they can tell you to see your GP afterwards. If it's quite serious, they themselves will get you emergency admission into the hospital.
Okay, so that would be like an ambulance that comes to pick them, take them to hospital.
Yes.
Because what I've heard is that in some people, not everyone, in rare cases, it's quite severe and they rapidly deteriorate. So that's one thing for our viewers to keep in mind. If it's not getting better, to really seek help quickly. And even if you're able to take people to the hospital instead of waiting, that's also one option. But if it is very serious, we have an emergency line. Let's say it's really severe and they can't talk, breathe. We have an emergency line, 999.
999, yeah.
Okay.
Call that number straight away.
Yes. So if you don't feel that you're able to talk to somebody on 111, and it's really much more severe than that, then 999 is one of the ways to go. So thank you so much. That's really helpful, because some people maybe don't know what is available to them in terms of getting help, and don't know what is severe, what's not. Now, just thinking about COVID-19, one of the difficulties I think for a lot of people is that we have to be socially isolated. That people can't go to their normal work. A lot of schools are closed. This sort of lockdown. What would you say? What is the purpose if we wanted to explain to people who are experiencing all this hardship?
Okay, so I completely understand that the lockdown is difficult. I was pretty upset when I found out that my gym closed, and I couldn't go to my favorite restaurant.
So we have to get all that home exercise now.
Yeah, so that really hurt me. And then I was like, oh God, it's proper serious if you're having to close the gym.
Yes.
But
exactly.
it is a serious situation. The lockdown is there for a specific reason, and that's to reduce the risk of spread, reduce the number of people who are getting unwell, and the number of people who are needing emergency admission or machines to help them breathe. That's the whole purpose of the lockdown. And
I guess there are some people who might say, well, I'm fine. They might even say, well, I've had a fever and cough and I'm better now. So like me, I've had fever and cough a few weeks back, and I think it was COVID. I'm better. But I can potentially still spread it to people, even if I don't get it.
Yes, you can. You can.
So
and there's no saying that you can't get it again.
Yeah, so, there's the potential of that as well.
Yeah. So it's very important to abide by the lockdown rules.
Yeah, because I think there are a lot of young people who feel, well, even if I get it, I'll be fine, or I've had it and I was fine. But they don't think actually the whole point of the lockdown is that it's not just about you as an individual or me as an individual, but actually all the different people that we could be giving it to who will become very, very unwell. So all of the people that are unwell in hospital, in intensive care, the people who passed away sadly, they got it from someone else, didn't they?
Yeah, so that falls in line with what I said earlier. Some people have no symptoms at all and still have the infection, so they are still likely to spread the infection to other people. And then others have really severe symptoms, and unfortunately, sadly, some people do pass away from this. And so if we can abide by the lockdown, it reduces the risk of it spreading by a great proportion, and that's what we want to do.
And I've seen all of this discussion about hand washing. What's the importance of that?
Hand hygiene, so hand washing is very, very important. We use our hands a lot to make food, to eat and drink, to put our clothes on, to brush our hair, to touch people. Kids, so if you are coughing, if you're sneezing, if you're unwell, you can easily just spread it through touch. So that's why hand hygiene is really important. Washing your hands, doing the happy birthday song for 20 seconds, really important.
And from what I've heard is that if you've got it on your hands and you haven't had the infection, then touching your mouth, your eyes, things like that, that's how it actually then gets into your system.
Absolutely.
So almost like being careful, even while we're washing our hands, not to be touching the areas that we could then infect. Because some people are wearing gloves when they go out, and I've seen this. But I've heard that a problem with that is you're still passing the virus from one place to another.
Yes.
If you're keeping the same gloves on and you're not throwing them away. So does hand washing break that chain in a way that even if you have gloves on all the time, won't do that?
No. So if you have literally the same gloves on all the time, you're literally going to be spreading it anyway. It won't do anything at all. I've seen a lot of people wear gloves when they're out and about, but then be touching their phone, their car, their keys, their coat, their scarf, their clothes, and then they'll go home, take off the gloves, wash their hands, but then they're touching all the things that they've just touched. So, they've touched the phone with their gloves, and now they're at home touching the phone that's not been cleaned with their hands and putting it onto their face, and it just doesn't make any sense.
So even on top of the hand washing, just general cleanliness and
absolutely
sanitizing all the things we use. Yeah, it's really helpful. And so in terms of thinking more about prevention now, we're talking. There are a lot of people that you see who are, I think, a high risk group. In the UK, our government has sort of identified a high risk group and given them advice. What can you tell us more about that?
Okay, so in the UK, the NHS have identified the high-risk group, and they've got this shielded program that they call. Okay. Basically, it's people who probably won't have a great immune system, who more likely to get things like coronavirus or even the flu and become really unwell. Right. It's this similar group that we give like the flu vaccine to and those kind of things. So people on who've got diabetes, who are on medication like steroids or chemotherapy, people with specific types of cancers, those types of people are at higher risk of becoming more unwell. And so those who we have to look after a little bit more closely.
Okay, that's really helpful. I've heard and I've read a lot about, when we're talking about prevention, a lot of people thinking, how can I prevent myself from becoming unwell? Asking about, multivitamins and wellness and things that they can do or take to prevent this. Is there any advice from yourself as GP that you give to people?
Absolutely. So the advice I give here is the same advice that I give every day about general health and well-being. So always make sure you eat a nice, good, balanced diet. So make sure you get enough veg in you, enough fiber in you, make sure you've got enough fluids, make sure you eat varied foods so you get the right amount of vitamins and nutrients in your body. That will help with your bones, with your muscles, with your immune system, with your heart. All these things naturally reduce your risk of becoming unwell. So you do this even more here. The thing about multivitamins, a lot of people are quite deficient in quite a lot of vitamins anyway, especially with the kind of diet we have. especially those in the Western world. We unfortunately are deficient in loads of different things. So multivitamins are helpful. However, the effect of it on your immune system or on your general health takes a while to kick in.
Right.
So it's not going to be taking a tablet right now and I'm going to be perfectly fine. You've got to take it regularly, consistently, with a good balanced diet and exercise, and that's how you help yourself.
Okay, so it's something that people can do to sort of keep that balance, but not rely on it.
Absolutely.
And if they do it, to do it consistently, daily, not sort of take it here and there and think that it's helpful. Okay, so that's really helpful.
With that, if I can just add to that, so you know, having a good balanced diet, taking the multivitamins, drinking plenty, exercise is key. Exercise is so important right now because we're in lockdown, everyone's at home. You really have to make sure that you're still moving about. Try and get your 10,000 steps in around the house. In my house, we do exercises nearly every morning.
Fantastic.
My mum and dad have become militant at this right now.
Very good.
You just spent 2 hours this morning exercising.
So we need that advice for all our Eritrean parents out there and parents of all group cultures.
There are so many exercises available on YouTube that you can do literally in your bedroom, in your living room, in your landing or your corridor. It's fine, and you with those exercises you strengthen your muscles, you make sure your heart and your lungs are healthy, you open up your airways, so you're naturally doing everything. It also helps with your mental health, so I definitely abide by that.
Fantastic. So in a sense, a stronger body that gets infected will be able to manage the infection better.
Most times,
and generally speaking, exercise and strength is important for our health and well-being anyway. Thank you so much for that advice, especially for our parents, but not just our parents, you know, our younger generation as well. Now there's something, and I won't keep you too much longer. I really appreciate all the time that you've given. There's something that I've been hearing about from other colleagues in the community, that, for example, you're working in the community as a general practitioner, family doctor, about people who are quite, so for example, elderly patients who are really unwell, might be in a care home, or they might be at home with their sons, daughters, but are generally unwell anyway, or generally quite weak and frail. If they become unwell, I've heard that some doctors talk about planning a plan if they were to become unwell, such that they can think about, well, if I become really unwell and sick, do I go to a hospital? Do I remain at home? Things like this. Is that something that people with older, really unwell parents should be thinking about?
Okay, so what you're talking about is it's something along the lines of an advanced care plan. It's basically for those who are extremely frail, so not just elderly, they literally don't have much reserve in their body to fight anything anyway, and so the chance of them becoming really unwell really quickly is really high. Some people who have metastatic cancers as well, those people fall under those categories. So those kind of people should already, even before coronavirus, should have discussions about what they want to do should they become really unwell. Do they want to go to hospital and receive every kind of intervention or treatment that is available? Or would they want to be left to just control their symptoms, so make sure they're not too breathless, not in a lot of pain, and be at home and be comfortable in their surroundings. Hospital and home are not the only options. There are others, especially here in the UK. There's plenty of different options for them to be looked after.
So that's in the extreme cases, like you said. Well, I guess something to think about if there are any of our viewers who have people that they know that they need to consider these things in. This has really been helpful. I just wanted to now move on to the general health problems that people have and sort of wrap up with that. I've heard that there are some people who have been so worried about going into hospital that even when they've been quite sick, they haven't sought to go to the hospital, and that's actually made them more unwell and sick. What advice do we have for people who need to get medical help for something which is not COVID related?
So we've, my line of work, we've actually dealt with a lot of those kind of situations. I recently had a patient who needed to go back into hospital, had recent surgery, was really, really unwell. And then the patient decided they were too scared of the whole coronavirus pandemic. They didn't want to go, and called them back a day later. They were obviously a lot worse. And if they actually went in the 24 hours earlier, they would have been looked after a lot better. There might have been a lot more safer, but unfortunately a lot of people are avoiding hospitals for these reasons, and it's not recommended that you do that. It's important that if you have, especially if you've got non-coronavirus symptoms, but it's something serious like a heart attack, like a stroke, like this person had a recent surgery and there was a problem with the operation, those kind of things, you should still go to the hospital. If you're really concerned, you can call 111, so the number that we talked about earlier. Your GP is another service that you can contact. So I had to deal with that patient as a GP. So we are available to deal with those things. Don't just think, oh, because of the coronavirus pandemic, I won't go in.
So call someone and speak to your family doctor, or if there's a health service like 111 in your country, or, you know, speak to their emergency services. Don't stay silent.
With this, I would say very, very clearly, if you have symptoms of a heart attack, if you are struggling to breathe,
serious emergencies.
A stroke, that's 999. It doesn't matter about the coronavirus or not, if you need emergency admission.
Thank you so much. That's really helpful. And so just to wrap up, is there anything else that you wanted our viewers to take away as advice in terms of how to look after themselves during this time?
Okay, so I've said it a few times, I'll say it again. Please, please, please make sure you're looking after your body, okay? Making sure you're eating very well, drinking well, getting the regular exercise. The other thing I would say personally is try not to watch the news so much. It's not helpful in any way. Maybe limit it to just once a day. But just make sure you look after your body. Make sure you look after, if you've got elderly people at home or people who have other medical or health conditions, make sure they're okay as well. And if you need any help, then there's lots and lots of services available to help you.
So get help if necessary. And viewers, listen to the people in charge, the healthcare workers. You know, if there's a lockdown and there are rules that you need to follow, please do follow them, because it's quite serious in terms of looking after your own health, but not just your own, other people who might be weaker and become more unwell if they get that infection from yourself. So with that, I'd like to really thank you, Dr. Eman Yassin. And hopefully we can have many more conversations like this and about other things. And if you want to ask questions, and potentially maybe we can even have a question and answer session in the future, just please leave some questions in the comments box. If you like this video, please do like the video on YouTube, subscribe to our channel, and please share it with people who can benefit from this. We really would like to show our appreciation at EritreaHealth for Dr. Eman Yassin's time, and we'd like to appreciate your time as well as viewers watching this. Thank you very much. Salamat. Assalamu alaikum.
Thank you. Bye.